Hello everyone! Welcome to another episode of PT Luis, and for today's video, I'm going to demonstrate the exercises for knee osteoarthritis. So this exercises is used to maintain your joint mobility and muscle function as well as help control and manage your pain and stiffness. You just have to prepare your bed and a piece of rolled towel, or if you don't have a rolled towel, you can use a small pillow. Now, if you're ready, let's get started. Okay, so basically what we're going to do are 5 simple exercises while we are still lying in bed. Okay, so these are your heel slides, straight leg raising, kneecap or patellar mobilization, quad sets, and your hamstring sets. Okay, so first we'll start with heel slides. So let's lie down. So what we're going to do is basically to just slide our heel onto the bed just like this. Okay? Now, if you're experiencing pain or stiffness in here, you can do it slowly and up to the limit of the motion. Okay? So, for example, if you're only feeling it until here, then you may do so. Okay? So, for this exercise, we're going to do it for 10 repetitions. So, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, next exercise is called your straight leg raising. So what we're going to do, we can bend one of our knee like this, basically to just lift the affected leg or the right leg up to the point where you can lift it. Okay, so assuming, for example, this is my only available range, then therefore, I will lift it until here. So parallel to my other leg. Okay, so you just have to lift it slowly and perform it for 10 repetitions. So let's do it. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, so for the next exercise, what we're going to do is called your quadricep sets. Okay, or quads is the muscle that is attached here on the anterior aspect of our thigh. Now, what we're going to do is we're just going to get our rolled towel, okay, and place it underneath the knee. When we're doing this exercise, you have to contract the muscle so that we can allow it to maintain its strength. So what we're going to do is just push our knee downward like this and allow our muscles to contract and hold it for 6 seconds. So you have to count out loud. So let's try. Okay? 1, 2, 3, 4, 5, 6. That's 1 repetition. And then we're going to perform it for at least 5 to 10 repetitions. Okay? So let's go. 1, 2, 3, 4, 5, 6. That's 1. 1, 2, 3, 4, 5, 6. That's 2. 1, 2, 3, 4, 5, 6. 3. 1, 2, 3, 4, 5, 6. 4. 1, 2, 3, 4, 5, 6. And 5. So you can do it for 5 more repetitions so that you will have 10 repetitions. Now, the next exercise is also in the same position. This time, you would put the rolled towel underneath your ankle. Here. Okay? Underneath your leg and your ankle. Now, what we want to do, okay, you can bend your knees like this on the opposite side. So, what we want to do is to actually push down on this area. So, you just have to press down. And same as earlier, we can count up to 6 seconds. Okay? So, let's push down. 1, 2, 3, 4, 5, 6. So basically, that is called your hamstring setting. So we are trying to contract this muscle, okay, underneath, so that it will help support your knee joint. Okay? Another one. 1, 2, 3, 4, 5, 6. That's 1. 1, 2, 3, 4, 5, 6. 2. 1, 2, 3, 4, 5, 6. 3. 1, 2, 3, 4, 5, 6. 4. 1, 2, 3, 4, 5, 6. And 5. Again, you can perform this exercise for 5 to 10 repetitions. Okay, so for our next exercise, we can call this our patellar mobility. So we can do it in long sitting position while still in bed. Now you can add a towel underneath your knee just to provide a little support. And you can bend your opposite leg like this. So what we're going to do is basically just to mobilize our patella or our kneecap. So it is the sesamoid bone or the small bone over the knee joint. Okay, so when you palpate it, it's actually this bone. Okay, so these are the corners of the patella, as you can see. So what we're going to do is to just mobilize it by basically moving it downward and upward and then side to side. So you can use the triangle of your hand and just push it first side to side and then count for 10 repetitions also. So like this, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And then another one is you can again use your hands and then just cup your patella, or you can do it like this and then just push it down and up, okay? Like this. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay? Alright, so basically those are the 5 exercises that you can do to address your knee pain and decrease mobility at your knee joint, especially if you have knee osteoarthritis. If you want to perform the exercise, you may do it so by performing 10 repetitions of at least 1 to 2 sets per day. You can do it early in the morning when you wake up and late in the evening before you get